My name is Anjali Chacko. I'm a second-year medical student, and I am here to present to you about REM as a mediator of fear-based memory. This presentation was made with the help of Austin Adkins, Dr. Sweden, Dr. Sanford, and Dr. Wellman from the Sleep Research Laboratory at EVMS. Post-traumatic stress disorder, or PTSD, is a stress and trauma-related psychiatric disorder characterized by hypervigilance, sleep disturbances, and flashbacks caused by the persistent recall of fear memories. Though it is still unknown why only certain individuals develop PTSD following a traumatic event, previous studies in our lab have shown that individual differences in post-stress rapid eye movement, or REM sleep, may play a role in the development of PTSD. Research suggests a link between REM theta wave activity, which are low-frequency electrical oscillations during REM sleep, and proper emotional processing and memory consolidation. Therefore, REM and REM-related theta wave activity may be useful to elucidate the etiology of PTSD and other fear-based disorders. 24 outbred Wistar rats were surgically implanted with electrodes to record the electroencephalogram, EEG, and electromyogram, EMG data, and intraperitoneal data loggers recorded body temperature. After recovery, baseline measurements were recorded. The rats were then exposed to a shock chamber for shock training, consisting of a 5-minute pre-shock period, then a 20-minute foot shock period, where they were shocked once per minute at 0.8 milliamperes for up to 0.5 seconds. This was followed by a 5-minute post-shock period. They were then returned to their home cages for sleep recording following shock training and divided into groups based on their REM responses. Those having a greater than 50% REM compared to their baseline were considered resilient, which consisted of 15 animals in total, and those with less than 50% REM compared to their baseline were considered vulnerable, which ended up including 9 animals. To assess the effects of fear memory on REM, the rats were then subdivided into 2 groups of 12 animals each and contextually re-exposed to the shock chamber without foot shock, known as context, either 24 or 48 hours following shock training. 1 week following context, the rats were next re-exposed to the shock chamber without shock again for assessment of extinction learning. Each session was videotaped to record freezing, a measure of behavioral fear in rats. Sleep was recorded following each experimental session for 20 hours. As shown in the freezing graph and the body temperature graph, there was no significant difference between resilient and vulnerable animals in terms of freezing and body temperature. The graph in the left corner shows differences in REM between resilient and vulnerable animals, with vulnerable animals having more REM at baseline than resilient animals, but resilient animals have more REM after shock training than vulnerable animals. Resilient and vulnerable animals were not significantly different in their REM sleep following context, and though it appears that resilient animals have more REM than vulnerable at the extinction phase, the differences were not statistically significant. This may be due to the difference in group sizes and the smaller number of vulnerable animals. When we look at episodes of REM, which is the graph at the bottom, resilient and vulnerable animals have similar episodes of REM, except after shock training. When we look at duration of each REM episode in the graph in the upper right corner, however, the duration of each episode of REM is similar for both groups. The only difference seems to be at the extinction at day 8, although this difference was not significant. When we look at REM-related theta activity after shock training, which is the graph in the bottom right corner, the resilient group had greater theta wave activity than the vulnerable group, especially during the second hour of recording. Individual differences in REM after a traumatic event may moderate the relationship between adaptive and maladaptive emotional processing and fear memory. A decrease in REM and REM-related theta wave activity may result in a lack of appropriate emotional processing and thus be predictive for the development of PTSD. In this study, the resilient animals had more REM than vulnerable animals, and the difference seems to be driven by more episodes of REM rather than a longer duration of REM per episode. Further study focusing on the role of REM-related theta activity may provide insight into the mechanisms underlying the role of REM in processing fear memory and its role in PTSD.